Now.
Okay, thank you, Dustin. Good afternoon. This is the convening of Central District Health Board meeting on August 4th, 2020 at 4 o'clock p.m. It is Tuesday. I will introduce myself. I am Betty Ann Middleton. I am one of the Elmore County representatives, along with Representative Megan Blanksma. We will go ahead and call the meeting to order, and I will take roll call according to counties. Boise County.
Commissioner Sturm here.
Valley County.
Commissioner Hasbrook, present.
Ada County.
Jane Young, present.
Ted Epperly, present.
Commissioner Lachiondo, present.
Elmore County.
Representative Megan Blanksma, present.
Thank you, folks. Okay, moving on to the action items. Number 3 is listed changes to the agenda. I will turn that conversation over to Director Duke.
Madam Chair, we have no changes to the agenda that require a motion or vote.
Okay, thank you, Russ. All right, moving on to new business. We have the minutes from our July 28th board meeting. If there are no additions or corrections, I will call for a motion to approve those minutes.
Madam Chair, I did have one correction. I just noticed in the minutes that it did not identify Mr. Reinhardt as being from the CUNA School District. So if we could make that correction, that would be good.
Okay, thank you for pointing that out, Diana. Is there a second to that motion with the chair? With a second, yes.
Madam Chair, this is Commissioner Hasbrook. I make a motion we approve the minutes as amended.
Okay, thank you. Is there a second to that motion?
Second. This is Jane Young.
Thank you, Jane. I will call for a roll call vote to approve the amended motion, starting with Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Commissioner Lachiondo, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. All right. Our next item under new business is to vote on the cancellation of our Tuesday, August 18th and Tuesday, August 25th board meetings. Do we have a motion to that effect?
Madam Chair, this is Commissioner Hasbrook.
Yes, Elle, go ahead.
Before I make that motion, I want to let everybody know that on the 21st is my anniversary, so I'm already in trouble. But I will make the motion to cancel the August 18th and the August 25th board meeting.
Okay, thank you, Els. Is there a second to that motion?
This is Commissioner Sturm, I second.
Okay, thank you, Ryan. We'll take a roll call vote for approval of that motion. Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted
Ted
Epperly.
Epperly, aye.
Diana Lachiondo.
Commissioner Lachiondo, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks.
Madam Chair, this is Russ.
Yes, Russ.
I just wanted to, for the public's benefit, explain why those meetings were canceled, because certainly the sense of urgency in dealing with the pandemic, but we do have our regularly scheduled meeting on Friday, August 21st. So that would have been 3 meetings in a 2-week period of time and the August 21st meeting is what used to be our normal meetings, and it starts at 8:30 and ends around noon. So it's a much longer meeting, and we will be talking about COVID as well as other board-related topics.
Okay, thank you for that clarification, Russ. Next, we will be discussing the community spread category designations for use by our school districts as determined by the guidance of the Idaho Department of Health and Welfare. And Russ, I'll turn that conversation to you once again.
Okay, thank you very much, Madam Chair. So I just wanted to start with Central District Health Department's role in the Idaho Back to School framework. So it's not our role to decide how schools operate under the various categories of community transmission. It's very clear in the Back to School framework that our job is to determine what the category of community transmission of coronavirus is, as well as a second role is to provide technical support on the operational guidance, which we've been doing all along, starting last spring and throughout the summer with a team of staff here. So I had committed to making it known to the public and certainly to our schools by August 3rd, being yesterday, what we were going to designate each of our 10 public school districts in terms of community transmission. So I don't think it will come as a surprise to anyone that no school districts are designated in Category 1. All 4 of our counties have had at least minimal community transmission, and that minimal to moderate places the schools in Category 2. And I'll also want to say, I know people talk about green, yellow, red, and that's Category 1 is green, Category 2 is yellow, Category 3 is red. So this was a document that was published on our website. There's also a link in the agenda so that individuals could view what we're looking at here at Central District Health. It's not 100% objective. There's certainly a degree of professional judgment that's required as we look at the different categories. So I'll start with the school districts in Boise County, Elmore County, and Valley County, and all of those school districts have been designated to a yellow category. Now that is as of yesterday. That doesn't mean that things won't change in the next 2 weeks. And I know that can make it even more challenging for school boards as they're making their opening operational decisions, but that's the state we're in today. And we plan to update this once a week, recognizing that schools are not going to be able to, essentially switch gears from one day to the next. They'll have to figure out how to manage that, and they definitely have the plans in place to do it. So I'll just start with minimal to moderate because that's the lowest level we have. It's anticipated that's likely to be the case at least for the first month or so into the 2021 school year. So minimal to moderate community spread is where there's widespread or sustained transmission. And as I mentioned, we have sustained transmission in all 3 of our counties right now. There's also another component to that. This guidance is sustained transmission more than 2 generations of cases outside of sporadic clusters. So what that means is if you have a household member who's infected and another household member becomes infected, that would be the second generation. But what we're seeing is cases, again, in all 4 of our counties where there's no known source. So when we do our case investigation, the individual essentially has no idea where they may have been exposed. So that criteria has been met. Facility or event-based outbreaks or clusters identified in the most recent 6 weeks, that's something that probably like for Valley County, we haven't had any significant outbreaks or clusters recently, but we've definitely had outbreaks in group settings there, as well as in Boise and Elmore, and goes without saying in Ada County as well. Then there's a potential for rapid increase in suspected cases. So we obviously saw that again throughout our district. No community has been spared, although I will say, and this I think speaks to the idea of the category changes that may occur over the next few weeks, is we're seeing some really promising data coming from our healthcare systems in terms of the ER utilization for COVID-like illness, as well as our case counts appear to be declining, which again, that's good news, but I wouldn't say we have enough of a trend to change course at this time. So then you move into the red category, category 3, and that has 3 components to it. Large-scale community transmission, where you have localized outbreaks or clusters, they merge to become indistinct. That's pretty much been the case since mid to late June. Healthcare staffing significantly impacted, and there's a couple of criteria that was put together for that. And I should mention, this criteria is developed by the Department of Health and Welfare to be used by all 7 public health districts. This is not unique to District 4. So the hospitals have indicated as late as the end of last week that they are being significantly impacted. And from the data that we're looking at, that's the one area we're really not seeing a downward trend yet in terms of people who are hospitalized with COVID and people who are hospitalized because of the COVID illness, the COVID disease. So I am hopeful that as we see our case count decline, that we're also going to start to see a decline in hospitalizations. And I expect we may see that as early as this week or next week. And then the third criteria under substantial community transmission is multiple cases within community settings. And we have outbreaks going on all over our community and workplaces. There's been some instances associated with childcare. Certainly our correctional facilities are having some challenges. So that criteria has been met as well. So Dustin, if you want to pull up the slide from our website, I wanted to show that to the public. That would be great. So here's what it looks like. If you go to our website, we have a dedicated page for schools that includes other information as far as the guidelines that we have for safe operation and, of course, the framework, back to school framework. But this is what it'll look like. And as we update this on a weekly basis, the color or category designations will change. So over time, that's what we expect. And I'd be happy to answer any questions from the board about the decisions we made for the category designations and the criteria we're using to make that determination.
Thank you, Russ. The floor is open for questions. I don't hear anybody speaking up, so is there anything further you would like to add, Russ?
No, that's it. I know the school boards are meeting right now, even as we have this meeting. So I expect they'll be making the determinations for how to go into their school year starting here in just a few weeks.
So it's, excuse me, Betty Ann, this is Diana.
Yes, Diana, go ahead.
So it's less of a question and more of a comment. And, you know, as both a employer and as a mom who had to juggle through the spring, I'm desperately hoping that we can get to a place where schools can safely reopen here in Ada County. Us being in the red zone is not good, no matter which way you look at it. I'm hoping that this will be somewhat of a wake-up call, sort of in addition for our community. I think as Russ noted, some of the cases that we're seeing here locally that are continuing to come out are less from maybe an individual public place like a restaurant or a grocery store, and more a family gathering, say a funeral or backyard barbecue, et cetera. And so it's just so much more critical for our residents to be thinking about how this impacts really one of the most important functions we have as a society, which is to educate the next generation. So I'm cautiously optimistic based on the numbers that we're seeing here in Ada County, and I get these reports from Russ twice a week. But we've got to be really, really vigilant. So hopefully we can find ourselves in the yellow zone as well.
Betty, and this is Russ.
Yes, Russ.
Yeah, I just, Commissioner LaScionda's comments reminded me of a comment that I did want to provide. I know, at least among some, there's still debate about the effectiveness of face coverings. And, the way I look at it is that is clearly one relatively simple, inexpensive tool that we can use to help drive down these cases. From a public health perspective, there's nothing more important to us here at Central District Health than making sure our kids get a quality education, certainly to keep them safe, the staff, the teachers, bus drivers, lunchroom workers, to keep them safe. But education is critically important. And as Commissioner LaScionda mentioned, it's not going to be simple for parents to teach their kids, to help teach, be part of the education process at home. So I just, can't emphasize enough the importance of the public to wear face coverings, whether it's a mandate like in Ada County or it's voluntary, encouraged in our other 3 counties. I believe that's the best route to get us to in classroom setting, move us out of the red category in Ada County, and maybe even move us out of the yellow category in some of our other counties over time. So it's more of a plea to the public that that's what we really need from you. We're starting to see that it's effective. As I mentioned, our cases are starting to decline, and I think if we have good compliance, we're gonna get to where we need to be much quicker than if we don't.
Betty Ann, this is Ted Epperle.
Yes, Ted, go ahead.
Couple comments. First, Russ, my appreciation to you and the staff for coming up with the solid criteria, recognizing this is all an evolution and we've just got to take a look at the data the best we can and apply it to the situation. I think the call is right. I think the 3 Ada County school districts are clearly in substantial community transmission areas. We're seeing community rates exceeding 10%. And with testing that's being done in the community, we know that young kids less than 10 years of age are testing at about a 10% positivity rate. So that clearly is consistent with substantial community transmission. So I think that's right. And then the application of that same data to the other 3 counties, I think landing in yellow there is appropriate. I think they can have a little bit more flexibility with what they're doing. I wanted to bring to everybody's attention, and some of you may well be aware of this, of what happened. It was reported by the CDC in the Morbidity and Mortality Weekly Report. It was the Georgia overnight camp that had 600, right at 600. This is back in June. And just a reminder that at that camp, 260 of those kids became positive. That's a 44% positivity rate amongst all the campers that were there. spread through all age groups. The group that was the hardest hit were the 6 to 10-year-olds, with 51% of the kids there being positive. And the lessons learned from that, as reported, were to echo really, Russ, what you just said. The two things that were the lessons learned were face coverings were critical. They didn't do as consistent an application as they needed to. And the second thing was social distancing was critical. Many of these campers were sleeping in close quarters. They weren't spread out, they weren't distanced. So I think the take home for the schools is really that we must be consistent with face coverings for all the kids in school, all of the teachers in school, all the everybody's within the facilities, and that we must do everything we can in regards to good social distancing. So I think those were the real take. I just want to also echo, Russ, the point you made. I think the reason we're starting to see some declining trends over the last couple weeks in the percent positivity in the community is because of the application of face masking and social distancing. It's been if you will, a heightened awareness and more consistency. I recognize not everybody's doing it, but I think more and more people are doing it. I'm certainly being aware of that, which is great. This is our only tool to really combat this. So I think we're on the right track. I would just say that the data as it speaks for itself, I think is accurate. 3 districts in Ada County being red, the other counties being yellow. And again, what the school boards do with this is their business, but I think that will inform them in terms of the substantial community transmission that we're still seeing. And I'll stop. Thank you.
Thank you, Ted. Any further testimony? Well, hearing none, the next item on our agenda is adjournment of our meeting. So do I have a motion?
Actually, Betty Ann, I think there's another agenda item.
And Madam Chair, this is Diana. Sorry, I didn't get to my unmute button quick enough. Just while we have everyone and we are, able to kind of share what's going on with the public, I just would love for Russ to report out on how we're doing at the Ada County Jail in terms of what they're seeing from the health side. I'm obviously privy as a commissioner, but we did have our first cases in the Ada County Jail. We've managed to hold off for a very long time, but are starting that. And so Russ, if you could just for the board's benefit and certainly the public as well, kind of share your work with the sheriff's office and how that's going.
Sure, Madam Chair.
Yes, go ahead, Russ.
Yeah, we've, as Commissioner Lasciando mentioned, I think I know they have good practices in place. I don't want to call it just luck, but given the significance of community spread and the movement of individuals, inmates, and as well as staff in and out of the jail facility, it's definitely high risk, and it is a communal setting. So as was mentioned, we have our first cases there. Just from my perspective, that's something that, we had the experience working with the Department of Corrections leading up to the first cases in the jail. I think the jail staff are doing an excellent job. We've maintained a good relationship with them from the start as far as their planning, their ability to isolate inmates and quarantine those who have been exposed, to remove them from an environment where the transmission of the infection is likely to continue. So it's hard to say it's totally under control. I think over time we'll likely see more cases. That's a given. We're going to see cases in lots of other environments. So I guess would reassure the public. I think that the sheriff's office and the team there and the healthcare staff are doing an excellent job and managing the situation as we would expect. And they, again, stay in close contact with our team and have been very responsive.
Thank you, Russ.
Betty Ann, this is Ted Epperly.
Yes, Ted, go ahead.
Thank you. I think there is an item number 4 on the agenda, which is further discussion around the existing order. Am I not correct about that?
Madam Chair, Dr. Eppley is correct. That was updated at the end of the week last week. So it was the second version, and that's why it didn't need to be voted on. It was published, I believe, on Friday afternoon. So Dustin, can you pull that up real quick just so everyone can see it? So this is it's been kind of a standing agenda item just because it's a topic that we do need to talk about. Whether or not there's a decision to take action or not is up to the board. It is under an action item, so you have the option to do that should you choose to do it. But it's really about the public health orders we have in place for Ada County and consideration for other counties or communities.
So, Madam Chair, I'd like to open a discussion on a couple.
Yes, go ahead, Ted.
Thank you. So, as I think we all know, as board members, certainly the public probably as well, the White House put out a report card last week on all 50 states and the District of Columbia in regards to how we were doing. And I think it was pretty well published that Idaho is clearly in the red zone. And in particular, Southwest Idaho is really in the red zone. They look at 100 cases per 100,000 as being significant transmission. We're at 214 cases per 100,000. And we've got quite a bit of activity going on. And in fact, they sent folks down to help both Ada and Canyon counties in regards to how we're dealing with things. I think we've been very responsible in doing this, but it called out 2 items that I'd like to bring up for the board's awareness. And that is, and this were policy recommendations from the White House and their coronavirus national team, was to limit social gatherings to 10 people or fewer, called out in the report and highlighted. And the second was to consider the closing of other businesses, such as gyms, and to create outdoor dining opportunities where possible, and to be careful about any aspects where social distancing is compromised that could lead to spread. So the issue I wanted to bring up, and I recognize how difficult this always is do we need to consider with our standing order a modification to decrease social gatherings to 10 people or fewer? And I'd like to ask the board that question and have a bit of a discussion on that at this time.
Madam Chair, this is Elt.
Yes, El, go ahead.
Ted, was there anything in that, because I know at one time they talked about going down to 25, 50 to 10 that fast?
Right there. Great question, Elt. Madam Chair, if I can.
Yes, go ahead.
Yeah, in the report, they didn't mention the 25 waypoint. I wondered about that too, but in the report, they call out 10 or less.
This is Elt again.
Yes, El.
Well, we got together, we tried to get it on the agenda last week, but we didn't get it done. But this week we voted as a commissioners to go back and put on some restrictions for Valley County to include mandating masks in all indoor settings unless social distance can be provided. We didn't want to start closing down restaurants or bars yet, but we do want to add our name to the list to try and slow this down up here. We've had quite a few more cases in the last 2 weeks. So I got a hold of Russ and made sure it was on the agenda today to ask for Valley County to be included in that order. And I think, Russ, I don't know, I hope you've been working on it and got it all written. Is that the case?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So I did talk through this with our attorney, Mike Kane, who's on the WebEx this afternoon. I guess I was never clear on the intent. It sounds like the intent is it would be for both public and private settings.
Yes.
So that was the difference. For Ada County, it's just public settings. So I wanted to have the conversation today and find out exactly what the interest is, and then look to Mike Kane, who can provide us some guidance on what's the best way to structure that. Do we want to do a separate order for Valley County that spells that out? Because if it's all indoor settings, not just public, then that would be quite a difference from what we've done in Ada County. And I know other health districts in Idaho and around the country have issued orders on a county by county basis, so we could modify that individual order and not change the existing order essentially.
Madam Chair, this is El. Sorry, Mike.
Yes, El, go ahead.
Well, the issue that we're having is we have business owners that want us to do this so that they can mandate that people wear masks coming into their business. Right now, they don't feel like they can do that. The political heat. So that's kind of the intent of what we're trying to do is take that burden off of them so they can require people that want to enter their business. And that's kind of a good question. I've never thought about that side of it. So maybe we need to rethink this, but that's the big issue is folks are calling and say, you need to do this so that we can tell people they have to wear a mask if they're going to come in here.
Mr. Chairman, Madam Chairman, rather, Mike Kane, can I get in on that?
Go ahead, Mike.
I think that if you wanted to achieve what I believe Commissioner Hasbrook is speaking about, you can use the same language that you have in the Ada County order. If you just say private, then you're drilling down into people's individual homes, and I know that's not what you're asking for.
No.
What sounds like you're wanting to do is have the same general requirements that are in Ada County. In other words, private businesses open to the public, such as retail, that is covered under the current Ada law, order. I would also recommend that you go with a separate order for Valley County if you choose to do this, because there's a lot more to the order as to Ada County than just mask ordinance right now. So I think it would be wiser to have a separate order that would apply to Valley County only.
Madam Chair.
Yes, El, go ahead.
The issue that we're having up here is kind of like when we had in March, where it's the bars and restaurants that end up being the pretty big spreaders. And we didn't feel like we wanted to go in there and close those folks down. We wanted to give them the option of, or at least the direction that if you're going to run a restaurant or a bar, you need to make sure your patrons are masked. And whether or not they do it, at least now they will have that option. The next step, I'm assuming on our part, would be to close down those kind of places. If the mask mandate doesn't work.
So, Madam Chair.
Yes, go ahead.
Just, somewhat anecdotal, but I just, shared with Eld. I was just up in Valley County this past weekend, and I think as we have talked about in the past, one of the big concerns I have for Valley County is just that back and forth between Ada County, which is a high spread area, and all of our folks coming to your community. You have a 16-bed hospital, and then knowing that if you get overwhelmed, they're coming back down here to Ada County. So it sounds like you've built some good rapport and consensus with your business leadership and with your fellow commissioners. And if we needed to do a separate order for Valley County, I'd be happy to support you in that regard. So Russ, is that something you're able to pull off some language for us to make a motion? What's the thought there?
Yeah, that was my question. I don't know what the procedure is.
This is
Yeah, Madam
Shane
Chair.
again.
Oh, go ahead, Mike.
I was going to say, if that's the direction that the board wants to go, the motion would be to adopt the current mask language that is within the Ada County order. That would basically apply to what I believe is being requested by Commissioner Hasbrook. Apply that to Valley County.
This is Chairman Nettleton. Just a point of clarification, Mike, that would apply only to the mask portion of that order, correct?
Well, yes, that's what I'm hearing the commission would be asking for. So you would have to lift that language, obviously substitute Valley County for Ada County, but only as to the mask order, which is quite considerable.
Madam Chairwoman, this is Representative Blanksma.
Yes, Megan, go ahead.
Elle, would you mind if I asked you a question?
No, anytime.
Do you need it? I guess the question is, would you have time for the draft language to be put together to look at on the next meeting, or do you feel like it's emergent? And the reason that I ask this is because we keep putting these orders into place and we're still not talking about metrics. We're still not talking about data sets that we're going to follow. We're still not talking about standards. But for once, we're getting somewhere with the schools, but you're in yellow, not red. And so I'm just, as a big picture, when we talk about implementing yet another mask order, do you think it would be appropriate to draft the actual language so that everybody understands what is being drafted? Do you have time for that, and to look at it in light of this new red, yellow, green system?
Yes, Elle, go ahead.
What's coming down for me is I have business owners calling me asking us to do this because, like I said earlier, that way they don't have to take the political heat or requiring them to come in their business. And I said, you can do that now. It's your business. You don't need anything from the health district. My goal is because we have so much more spread up here, is to it's not just the people from out of town, it's also our locals as well. We certainly have an area that thinks it's silly and they're not going to comply. But I think, to me, my feeling is this is a start. If we can't slow it down, then I'm assuming the next step would be that we would close down the bars and the restaurants again, like we did in March, and get on top of it again. We're just kind of trickling behind Ada County, I think, as far as mandates and requirements. But we talked a great deal about we didn't want to shut anybody down just yet because it's the most important time of the year for their business and they can't afford that hit. So we said, well, let's just mandate the mask. Now, if you want to, if we can do this, I assuming we're going to meet next Tuesday. If we could have language by next Tuesday, then that would work for us as well.
Hey, Madam Chair.
Yes, Diana, go ahead.
This is, I guess I'm hearing sort of both viewpoints. I agree with Megan that it's helpful when we have language out there for the public to review. I'm also knowing that every weekend we have thousands and thousands of people going to Valley County, and we're getting ever closer to schools, hopefully, and you guys staying in the yellow zone. So I really would be prepared to go either way, but I guess the question is, do you feel like your businesses need this weekend to be able to do what they need to do?
Yes, Elle, go ahead.
Businesses have been requesting it for a couple of weeks. Last week, we didn't get on the agenda, so we couldn't talk about it. So I did a better job, not only at commissioner level, but on health, on this meeting as well. I couldn't seem to get on the agenda either. Our internet up here sometimes works and sometimes doesn't, but we had a long, hard discussion about it on Monday and figured that how to do this to show the public that it's getting worse up here, and this is the next step.
Madam Chair, this is Representative
Yes,
Blanksma.
Megan. Yes, Megan, go ahead.
Thank you. And I guess I have the same concern I have at every meeting. And then I guess I would also remind the body that we had an issue with language included in last week's order. And so I guess I have difficulty saying that I would be willing to approve anything that I don't see a copy of, so that it's very specific about what we're approving. I have real reluctance to do that.
Madam Chair, this is Elle.
Yes, Elle, go ahead.
I would be definitely willing to wait until next Tuesday to confirm this with the rest of the board, and that way we could get the language this week and take a look at it and get share with commissioners and make sure we're all on the same page before we approve it. I don't have that problem. That's okay. So about the floor, I would have a motion that we write up that resolution, or whatever you call it, mandating masks without accounting for all indoor public places.
Elle, this is Chairman Nettleton again. I'm having real difficulty hearing you. I'm not sure I got that last statement you made.
And make the motion that we have the health district draft up a resolution for Valley County mandating masks for indoor public places.
Madam Chairman, this is Representative Blanksma again.
Yes, Megan, go ahead.
Hey, I would just suggest that rather than going and making a motion that it can be easily requested of Russ. That's what it appears Ada County did prior to the original mask mandate. And then you'd have the opportunity to work with him for a draft so that it looks like what you think Valley County wants.
Well, whatever we need to get the ball rolling is what I'm trying to do.
Madam Chair, this is Diana. I'd like to ask Mike what he would prefer. Would he prefer for us to make a motion, approve it, to have the staff work on this, or should Elt just have a conversation with Russ?
Well, it's not really a question of what I prefer. It's really the question of what the policy of the board is going to be here. I think Representative Blanksma is correct. I mean, if what you want from us is a draft, we can certainly prepare that. All we need is direction. We don't need a motion for that.
Okay. Well, then I guess I'll just concur with Commissioner Hasbrook about asking for that draft to be worked on.
Madam Chair, this is I'll rescind my motion too.
Okay, thank you. That was my next question. Thank you. So, okay, Russ, you have your directions as far as coming up with the draft language for Valley County regarding the masks. I guess we'll have that presented then next week, Russ, correct?
Correct. And my goal will be to get it published on our on our website on the board section like we've done with previous draft orders so that the public has an opportunity to review it. Of course, I'll work with Commissioner Hasbrook ahead of that to make sure we get the language right.
Okay, thank you.
Madam Chairman, this is Ted Epperly.
Yes, Ted, go ahead.
I'm glad for the conversation we just had about Valley County and masking. And I think that's the appropriate step, is to bring back language. I want to return to what I initially brought up, which was the results of the White House report and the question around the consideration of moving group sizes down to 10 or less, actually less than 10, and also about the consideration of, do we need potentially more business closures, in particular gyms? It strikes me that we could certainly, depending on the board's discussion, have Russ work on language around those issues as well. I just want to return to the White House received. They're calling out Idaho, and in particular Southwest Idaho, in this report for our percent positivity. They want us to take further action. I quite frankly think further action is warranted. We're at community rates that exceed 10%. We have case rates that are 214 per 100,000. The cutoff is 100 per 100,000. We're 2.14 times higher than that. The national average is at 140 per 100,000, and this is the most active country in the nation or in the world in terms of COVID-19. So I think it's clearly relevant for us to consider, have we not done enough yet to slow this down? I think the issue is really important because about categorizing schools as category 1, 2, and 3, green, yellow, and red. If we've not done everything we can in the community to slow community spread, we have with face masks, we have with distancing, we have with hand washing, we have with groups of less than 50, but we've not taken the next step of the social distancing of potentially down to 10 to slow community spread. This will, one, help our schools be better protected. Number two, help, again, both businesses be in a position where they don't have to be shut down at some future point. So what I'd like for us to absolutely consider is, do we need to do more? We could consider draft language, have it come back at the next meeting. That way the public could also see this. But in particular, what I would bring up is decreasing community groups to less than 10, and the consideration for closing gyms, and I'll leave it at that.
Madam Chair, this is Jane Young.
Yes, Jane, go ahead.
I just want to put in 2 words of support for what Dr. Epperly just said.
Okay, thank you.
Madam Chair, this is Elt.
Yes, Eld, go ahead.
Ted, that's why I was kind of talking earlier about the number 25. From going from 50 to 10 is quite a drastic leap, and I'm afraid we're gonna either scare or make a lot of folks mad. Would you consider going to 25 or 20 first for a week or two to see how that works, and then maybe going to 10?
Yeah, that's a great question, Elt. And Madam Chair, if I can just respond to Elt's comment.
Yes.
Yeah, I think that's very reasonable, Elt. Perhaps that is an interim. It's hard to know, right? We've got significant community spread. We do need to get on top of it. The faster we get on top of it, the better we can do in terms of getting other things back to normal. It's hard to know. The report calls out going to 10. I'm comfortable at 25, I think, but I'd hate to be, again, behind the 8 ball on this because it takes 2 weeks to see the results. I really believe we've made an impact with face masking, decreasing and closing bars and nightclubs, decreasing group size to 50. I think consistent with, and for the most part, the White House, pretty conservative group. They're not going around making tremendously liberal recommendations. They're making, I think, what are evidence-based recommendations. They call 10. Love to hear what other members think in terms of the 10 or 25, but I think we probably need to limit social size further than the less than 50 that we're at now, and I'll stop.
Madam Chair, this is Diana.
Go ahead, Diana.
So I guess what I'm struggling with this on a number of different fronts, and more that, and I'll have Russ kind of, confirm this for me, but it's my understanding that our contact tracing is showing cases coming out of less, public settings and more, your backyard barbecue, your baby shower, etc. And if people aren't doing what they need to be doing now, with wearing masks, etc., in those scenarios, I'm just not sure that further restricting in the public sphere, if it's restaurants, for example, is going to get us where we need to go. I agree that getting schools safely opened has to be a top priority. Absolutely. I just am wondering, from what we're seeing in the data and the contact tracing, Russ, where this leads us.
Madam Chair.
Yes, Russ, go ahead.
Yeah, to Commissioner LaScianda's point, and we've tried to do this right actually from the start with the closure of bars and nightclubs, is the areas where we're seeing a lot of the cases through our, we have a case, somebody shows up positive, we talk to them, we find out who they were around, who they may have been exposed to or may have exposed with their own situation of being infected. And it is what we look at or call social gatherings. So those are the, actually there's been some cases come out of golf events or family reunions or large birthday parties, and as well as in workplaces. So we're seeing, and again, not like a restaurant workplace per se, but just general workplaces where employees have been exposed to coworkers. So, I guess when I look at it, the gathering size of 50 is large, where you're likely to be able to pull people in to that whatever event it might be that's not necessarily directly related to your immediate family, people who you're living with, or parents, children, aunts, uncles. And I think trying to figure that out, to Dr. Epperly's point, is 20 or 25 better than 10? Not better, but as a compromise. And I think what we have right now is we're starting to see a bit of a downward trend. That's encouraging for certain. And any further community restrictions would likely drive that down faster. I think that would be the end result if there was good compliance, for example, with no more than 10. That would probably get us to where we need to be quicker. It's just a matter of the policy decision of the board, like we've debated all along. But point being, I don't think we're seeing it necessarily coming out of a particular work site or a particular public setting, but more a lot of the private gatherings and private workplace exposures.
So, Madam Chair, this is Diana too, and I think, everything's on the table because the data is constantly changing too. So, we can review that potential order for next week as well. I guess, I'll just say this as well. We are so interconnected in this valley, and, people are working and living across Ada and Canyon County especially. And I have a hard time imagining how we're going to achieve the healthcare objectives we need to achieve if we restrict even further, but but yet in one county over, there's nothing in place. And so I'm open to all suggestions to achieve our objectives. I just, again, kind of am wondering how effective we think that will be. And I guess I'd speak to you, Russ, in terms of the conversations we're having with the hospitals, knowing that Nampa has been shifting patients to Boise quite frequently.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
I mean, that's definitely a challenge we face. Our communities have completely grown together in lots of ways, not only housing and businesses, but the transit back and forth between our two counties. The question as far as the community restrictions actually came up on a call earlier today as far as what category do we place our schools in. And that's a fair question. When we look at the criteria that I talked about earlier, as far as the community transmission, do we have to balance the hospital situation? I'll say it, on the backs of the residents of Ada County, and I don't think that's appropriate. I don't think it's fair. I think if we can drive our cases down, and we see less community transmission, to Dr. Eppley's point, looking at positivity rates and case counts per 100,000, then my recommendation would be we may start looking at relaxing our orders, even if the hospitals continue to be impacted by counties outside of our public health district, for which you and I have no control over what they do.
Madam Chair, this is Al.
Yes, Al, go ahead.
This really is for Russ or Diana. Are you seeing the same type of situation in the small counties as far as, you know, the weddings and the baby showers and all that stuff? Or is it like in Valley County, we've heard quite a few cases coming out of 2 or 3 separate businesses in the county. And it's not from family gatherings or anything like that. It's just 2 or 3 businesses that have ignored everything and opened it wide open. And is that true? Is that a true statement, or are you seeing that across the board in all counties?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, Commissioner Hashbrook, I'm not sure of the most recent specific cases in Valley County. And I will look into that, and that's something we can talk about at next week's meeting. One of the things I want to talk about and follow up to Representative Blanksma's comments all along at most of our meetings, coming up with the criteria. How do we make a decision to move between the stages per se, although we've kind of moved away from the staging concept with mask mandates, for example. So I'll want to talk about that more next week, and I am inviting our epidemiology section manager, Kim Link, to join the board meeting to go through that, and we can look at seeing if there are differences between our counties. The one point I was going to make, I am aware to Diana's conversation or comments earlier with the number of people that go to Valley County. We're actually having people diagnosed in Valley County who live in Ada County because they're up there so often and spend a lot of their time. And it's not just weekend activity, but people go up for a week or maybe even work up there part-time. So that's what we're definitely seeing Valley County impacted by Ada County.
Madam Chair, this is Jane Young.
Yes, Jane, go ahead.
When we were listening to Dr. Peterman and Dr. Pope before, did we not talk about getting down to a 5% positivity rate as recommended for school opening? I'm asking generally, I'm asking to see if I'm remembering it right.
Madam Chair, this is Russ.
Yes, Russ.
Dr. Young, you're exactly right. That's been that target. And what I want to make sure that confused with just looking at a positivity rate in and of itself can be influenced by so many factors. So if you have an organization, which we have primary care provider groups that'll go in and do mass testing, and they're testing everyone, naturally, you're going to see a lot more negatives in that environment versus on the other end of the spectrum is providers who only test individuals who have symptoms of COVID. The positivity rate would go up. But blended, if you look across the spectrum, which we definitely have throughout our public health district with our provider situation and testing availability, is if everyone's able to get tested, which they're not today, what that positivity rate is a good indicator of is testing access and availability. So when we look at positivity rate and trying to get it below 5%, that's really what we're monitoring with that positivity rate. And the importance of that is when you have a 10 or 15% positivity rate and restrictive testing, which again is the case, we're missing people who are positive, whether they're mildly symptomatic or asymptomatic. And that does not allow public health to do our job, which is contacting the cases, getting them isolated, contacting the contacts, and getting them quarantined for that 14-day period of time. So I just wanted to make sure everyone understood what that's for. But the short answer, Dr. Young, is yes, it's 5% or below is the target.
That was really helpful. Thank you.
Madam Chair, this is Al.
Yes, Al, go ahead.
Another thing that I think we're seeing up here, two things actually. I think there's a few folks from, we just call it down below, that come up here and are sick or continuing in their camper or in their home. And the other issue that we're having up here is a lot of people that have been sick with the disease but have not seen a doctor or anyone, just stay home. Those people aren't even being counted. My point is that we really need that data up here to know if there's something that's coming from, a business store or a restaurant or whatever versus a reunion, because to me, that's my decision that Ted's talking about going from 50 down to 25. More important than that, 25, if I knew it was all coming from, similar businesses that aren't taking it serious.
Well, I guess.
I'm sorry, who just spoke up?
Sorry, this is Diana, Madam Chair.
Okay. Yes, Diana, go ahead.
As I said before, I think everything's on the table, and I'd support drafting that language and letting us think about it and look at it for a week, and certainly have the public know that we're thinking about it. And, and with that in mind, I guess I would just put a plea and a call to action out there for the public who may be listening to this, that we are making great strides, but in order to achieve what we need to achieve, not overwhelm the healthcare system, and just as important at this point, get schools reopened, we need them to do their part in their private gatherings as well, knowing that that's where a lot of these cases are coming out of. And it's not fun. No one enjoys it. I'll just share that I'm headed to a family funeral on Friday that's limited to 50 people, and I'm have volunteered to be the mask lady to hand out masks and ensure that people wear them, because it would just be so terrible for to celebrate the life of someone, but then to have potentially illness come out of that, both for that family as well as for our community. So it's really more of a comment that we need more from the community so that we don't have to implement further restrictions.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
Thank you, Betty Ann. I'd like to just clarify, I think what Commissioner Laciando just said. If we could bring back for our next meeting some draft language around both 25 and 10 so that we have both considerations in front of us. Elt makes a great point. Should there be a midpoint between less than 50 and less than 10? I think that's a great point. So perhaps we could consider draft language looking at groups less than 25 and groups less than 10. I think it's important for us to consider. We'll have another week's worth of data as well in terms of what is happening in our community. I would also like to have us consider draft language about closing gyms. This has been called out in the White House report as well. I have nothing against the gyms in our area. They're important to people. I don't say this lightly, but I just think we need to look at everything we can do to help decrease the rate of positivity and transmission in the community. Because at the end of the day, doing those things now will help us accelerate the pace of getting back to normal later. Schools back online, businesses back online. The longer we delay this, the longer we delay this. And there's danger if we keep delaying that we start backing this up into the fall and winter timelines and we get overlapped with influenza and other viruses. It starts to get complicated. I just think we can't be slow in jumping on this now. So if we could consider language around both groups less than 25 and potentially a modification for groups less than 10, also consider language for gyms to be closed in addition to bars and nightclubs. That way the public can take a look at that, the public can comment. We will then consider and act on that at our next Tuesday's meeting, along with Elt's earlier recommendation about face masking in Valley County.
Eddie Ann, this is Representative Blanksma.
Yes, Megan, go ahead.
I just have a couple comments, and I sound like a broken record, but it's the same comment of we're continually trying to figure out how to put more mandates on people to get a moving target down. And so if we're going to look, and we were able to, the staff was able to identify a red, yellow, green system for the schools that actually reflects conditions within the districts and the counties. I don't see any reason why we can't start providing some structure as to why we continue to ask for additional mandates. Now, Dr. Epperly made a suggestion that reviewing the White House report would be a place to start. I would say then why don't we look at some of the standards and metrics they used to create their report and maybe start applying them to the mandates that have been created by this board. And I just think that's really important because we've gone, I believe it's a month and a half now, where every meeting, the only thing we discuss is what additional mandate we want to put on what population. And regardless of how many times I bring it up, we still don't have a set of standards as how to move in and out of these mandates. Now, I think we have a really good starting point at this red, yellow, green system that's been provided for the schools so that they can use their best judgment in providing educational models for the kids in those individual districts. But I think it's really important that we provide some stability for the rest of the members of the community if we're going to continue to review these mandates. And I think that also becomes important when we listen to Russ say that there's the potential that we can back out of some of these things rather than continue to push forward and shut down more businesses and impact more lives in a negative manner rather than trying to impact them in a positive manner. And so I know that I say this every meeting, but because we don't take any action on it whatsoever, I'm just going to continue to repeat it. We need to have some sort of standard to which we are measuring these orders that we are putting into place.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
I can't let it just stand as stated. We have been very clear in following the rebound Idaho guidance that Governor Little and the Idaho Department of Health and Welfare have laid out. That data points and those data points are around syndromic data, around epidemiologic data, and around clinical data. For you to say that this has all been done without any data points for consideration is wrong. We've absolutely looked at data at all aspects of this. In addition, we've brought in positivity rates from the community, the best we have in regards to what's happening, both at the emergency room level and at the primary care clinic level. So we've also considered input from the hospital in regards to what the hospitals are seeing, both in terms of admission rates, of ICU rates, of what's happening in the hospitals that concern them. So I'm not sure what you're referring to, Megan, when you say that, but I'm going to just say that that is a false statement. We have looked at a lot of data from multiple sources to make these. This is not something plucked from the sky based on something that isn't data-driven. And I'll stop.
Madam Chairwoman, may I respond?
Yes, Megan, go ahead.
That is not at all what I said, Dr. Epperly. That is completely inaccurate representation of what I'm trying to say. What I am saying is that we have not given the public a actual path into and out of these decisions that are being made. We've had presentations with data. We've had data cited, but we don't have a clear path because we haven't strictly followed the stages that were provided by the governor. We haven't given people stability as to when we are or are not going to move out of these phases. I have business owners that do live in live in Elmore County that try to do business in Ada County that are constantly calling me to find out what they have to do so that they can reopen. What phase are we going to have to go to so they can reopen? And that's what I'm asking for. I'm not asking for anecdotal evidence. I'm not asking for just a specific data point. What I'm looking for is a structure so that people within this health district understand why these certain orders are being implemented. Now, if you want to use what is the White House model to implement orders, then at least call it out so people truly understand what's going on, because I truly don't believe, based upon all of the emails that I'm getting, that people clearly understand why we continue to mandate rather than giving them a structure just like this green, yellow, red structure that you can clearly look at and clearly understand this is what category I fall into and these are the recommendations made. So to say that I'm promoting a falsehood, I take as a huge insult. This is the same argument that I continue to make of there needs to be some structure as to why things are implemented, rather than just taking anecdotal evidence and a couple of bits of data. It's important to provide structure if you're going to continue to make these orders that impact people in the way that they do.
Madam Chair, this is Ted Epperly.
Yes, Ted, go ahead.
So it's pretty clear that we've been using data all along. Now, what we can do is to make sure that we publicly address then what all of these data points are, so that you won't continue to say at every meeting what you continue to say. Let's put out the epidemiologic, the clinical, and the syndromic data we're basing this on. Let's put out what the White House data points are so that we don't continue to have this circular discussion about we are not using data to make these decisions. We absolutely have. We're not sitting here, and I'm clearly not sitting here making this up. This data is coming from data that we have within our state, along guidelines that we've been using consistently all the time. If the community is confused, then let's clarify that with some educational points. Let's clearly publish every single one of the Rebound Idaho clinical, epidemiologic, and syndromic criteria for stages. When we went back to stage 3, that was based on data. The White House report is based on data, so let's publish it so that people can see this and you'll stop saying this. When we ask experts to come in and talk to us about what they're seeing in their hospitals and what data they're using, let's publish that so that we can get beyond this point. This is exactly what I'm saying confuses the public, is when they hear from somebody on the board that we're not using data, it's not data driven, it's giving the false impression to the public that this is some mandate board that is doing this for no good reason. And I'll stop.
Madam Chairman, one last point.
Yes, Megan, go ahead.
I think it's important that on the House floor, that it's actually against one of our rules to name call and say that people are claiming falsehood. And instead, it's about talking about the issue at hand and making sure that everything's clearly understood. And that's what I'm trying to say, is that for every time a decision's made, there should be very clearly an outline of why the decision was made and what it would take to reverse the decision. And we haven't provided that clearly in any of our statements. Otherwise, we wouldn't get the emails. That doesn't mean that people are uneducated. That doesn't mean people are anti-mask. That doesn't mean that any of those things that you don't agree with the data points. None of that is what I'm talking about. What I'm saying is that it's important when you place a mandate in that the public understands why a mandate exists and what they do or don't have to do to get out of that mandate, or what they do or don't have to do to push it forward. That's what I'm talking about. I'm not claiming that anybody's statements were true or false, and they never have. What I have said is that there needs to be a set of standards that's very clear to the public as to why each decision is made.
Madam Chair, this is Diana.
Yes, Diana.
I just want to make sure we're all sort of talking about the same thing to some degree. Central District Health has been publishing the syndromic and hospital data, epidemiologic data on the website every week. And I think one of the challenges that we've had is making sure we're getting the right data sets. There was a period of time there where we were looking specifically at ER hospitalizations, but then hearing from our hospitals that they're doing so many direct admits of COVID patients that it wasn't necessarily reflective of what was going on. So I hear you, Representative Lakesma. I like data. I like to be able to know what my metrics are. I think ultimately one of the challenges we have is that we're going to have to pair that with continuing to listen to our hospital leaders. And right now, our hospital leaders have continued to say that they are scared, they are worried, they're losing staff, and they're having to pull staff from other places. So that's, hopefully we're going to start to see that trend reverse as we see that we've had some leveling off of cases, but we're not there yet. In my husband's practice, all of the hybrid physicians, which are physicians who practice in both an outpatient setting and in the hospital, have been pulled out of the clinics. They are not seeing people for hypertension or diabetes. They're in the hospital. So this is going to be a balancing act, and it's not perfect, but we're going to continue to have to refine it.
Yes, Elle, go ahead.
You're coming from, and it's people want to know, what do I got to do to get back to my old life? Well, I hate to say it, but it's going to be quite a while before you're going to get back to a normal life because of this. But in our situation, we had a doubling of cases within a week or 10 days in Valley County. We can't just not do anything. I know it's not the big numbers like they have down in Ada County or Canyon County, but when you double your cases as community leaders, you have to step up and do something. And maybe it's reactionary, but sometimes that's the best leadership, is reactionary leadership. I feel like I'm on the right side of the issue when I ask my fellow commissioners, can we mandate masks for people up here? And they all agree. I don't have particular data. I don't have all the details on the hospitals and how many folks are in ICU and all that kind of stuff. I just have a gut feeling that tells me if we don't do something here, we're going to have 500 people here or 1,000 people up here. And we can't handle that. There's no way. So I'm asking for a mandate on masks. It's a pretty simple thing.
Madam Chair, this is Jane.
Yes, Jane, go ahead. This is a question directed to Russ. Are you working on the recommendations for the criteria to move between stages?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, so we have recommendations for consideration to move between stages. That's been published on our website since June 22nd is actually when we first published it. The challenge that Diana, Commissioner Lasciando talked about is we have a ton of data, and we have a ton of data published on our website. The public can go in there and look on a county by county basis. In Ada County, we published statistics at the city level because they're larger cities and it would not be able to identify an individual because of the population size. We have demographic information, date of onset, date of report. So the data is there. I mean, that's the data that I look at. And it is definitely made available to the public. The question is, when do we start? I think the real question is more restrictions or less restrictions or stay where we're at. And it is extremely difficult to pick a specific data point or even a set of data points that'll say, when you get to here, here's the action you take. I mean, like I said, even with the school guidance that Department of Health and Welfare put together, there's subjectivity involved in that, and really the professional judgment that has to be made because situations change. That's the one thing that's been constant with this epidemic, pandemic outbreaks in various sectors of our community is the constant change. So we haven't published, we haven't pushed real hard on that because of some of the challenges we've had with getting consistent data from different data points. Even the federal government recently changed how the hospitals are reporting their data. So I want to take a lot of time. At our next meeting, we'll have the proposed orders or draft orders to discuss, and the rest of the time I want to dedicate to talking about the data that we're looking at, that I know the board is looking at, and really talk through that, because it's not simple. But again, the data is out there and our criteria is out there, but it's hard to really pin this down to, if this happens, we do this. It just doesn't seem to work that way. I understand the desire to have that, and that's what we'll work toward.
Okay, thank you, Russ. Any further comments from the board?
So Betty Ann, this is Ted Epperly. If I can just circle back to the actions. So Russ, it sounds like for our next meeting, you will draft up language that would take a look at several things. One is the face masking issue in Valley County. The second would be a variation of group size decrements. One looking at less than 25, one looking at less than 10, and then potential consideration for looking at the closure of gyms. And I just wanted to make sure that's where we're at in terms of what we'll be looking at next Tuesday.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Dr. Epperly, that's correct. That's what I have in my notes, and we'll begin working on that following this meeting. And like I said, I'd like to get them published no later than Friday as a draft. Decision won't be made, or maybe not made at all, but it'll be a consideration of the board next Tuesday. And like always, we receive a lot of public comment. We received over 200 emails that was passed on to the board for you to review. We have a cutoff point of 24 hours in advance of the meeting, so 4 o'clock yesterday, and we basically package that in a PDF and pass it on to the board. So any comments we receive on these draft orders, either from the discussion today or after they're published on Friday, will definitely be made available for the board's review ahead of the meeting.
Thank you, Russ.
Okay, thank you, Russ. Okay. Any further testimony, discussion?
Madam Chair, this is Jane Young. I had one more question.
Yes, Jane, go ahead.
Megan, is there a way that you might be able to bring an example of what you're asking for so that maybe we could understand differently what you're requesting?
Yeah, thanks, Madam Chairman.
Yes, Jane, Megan, go ahead.
I would just point back to the red, yellow, green system that we set up for the schools so that they could act accordingly. So if we're going to look at a set of metrics, what if hospital admissions go up by, I'm just throwing numbers out there. This is not anything that I'm pulling directly from a data set. But if hospital numbers go up 25%, rate of transmission is at 20%. You know, if we have a set of things that are happening in a community, then we understand that the additional step is to go X. And that's what I'm trying to get, is so that people understand the importance of some of the preventatives that can be done in their communities. And so while there's plenty of data that's up there on the website, I understand that. I know how to navigate the data. What I don't think people feel like they can navigate is what standards we're holding before we change the conditions in their communities. And that's the one thing about the color-coded system that Russ and his staff put together for our school districts, is it's very clear. If you have these particular conditions, this is our recommendation. And I think, because I could look at that as soon as it came out, and I could look at my kid's school district and go, okay, great. And then I could go straight to my school district plan, and it told me what they were going to do based upon those conditions. And that provides some sort of predictability for people. And I think that that's what's been lacking. And I hope that answers your question.
Thank you.
Okay, thank you, folks. Under number 3, new business, I'm not sure I have the same agenda copy, Russ. I only have one talking point under that, discussion in community spread category. So I'm not sure if there are other points under number 3 or not. Would you clarify that for me, please?
Yeah, Madam Chair, we were able to cover everything under that agenda item, so we're good and finished the discussion. It sounds like on the potential actions with the 3 specific focus areas that we'll work on drafting orders. So that's it. I think there is no, that's the end of the agenda, other than the adjournment, unless there's further discussion on community restrictions or quarantine.
Okay, any further discussion regarding those issues then? Hearing none, I will ask for a motion for adjournment.
I move to adjourn.
I second.
Okay, the motion has been made and seconded for adjournment. I will take a roll call vote, starting with Boise County.
Commissioner Sturm, aye.
Valley County.
Commissioner Hasbrook, aye.
Ada County.
Jane Young, aye.
Ted Epperly, aye.
Diana,
Commissioner Laciando, aye.
Elmore County.
Representative Blanksma, aye.
Okay, thank you, folks. Motion has passed to adjourn our meeting for today. Our next meeting will be August 11th at 4 o'clock, and I want to thank not only the board for everybody's input, but also for the public that has listened in and all of the emails we do receive. So thank you so much, and as I stated, we will be back on August 11th at 4 o'clock. Thank you. Goodbye.